So Dr. James Goolnik, doctor but a dentist, and I want to ask you some dentist questions if that's all right.
No, great, Steve.
So why is it, first question, in fact let's go way back, what's the best things we can do to look after our teeth, predominantly with our children, so they don't end up like I have with loads of fillings and root canals and cappings? What steps can we take for our children?
Number one thing is diet. It's what you put in your mouth, basically.
Okay.
If you're going to eat rubbish, then you're going to cause tooth decay and having problems in your mouth. So first of all, actually look at what you're eating and what you're giving your children, and look at where the sugar is as well. So what has got added sugar in and what things have got hidden sugars, like the breads and the pastas and things like that. So know what you're eating first. That's the first thing. Second thing is take them to the dentist. We usually recommend as soon as they've got teeth, so probably from about the age of 2, to take them to a dentist, because we want them to get used to the experience, get them comfortable there, have a fun experience, have their teeth polished, get stickers, and not associate it with having treatment, having any discomfort. It's all about it's in a relationship and getting it comfortable. So that's the thing we want them to have done. The next thing we really want to do is just brush their teeth, because some kids don't brush their teeth. So actually just brush their teeth.
Even today that still happens? Wow.
And actually, I've got a teenager, and sometimes I have to remind him.
Oh, I have actually, come to think of it.
Have you brushed your teeth this one? No. So that's the big thing, to actually brush your teeth twice a day. That's the research says, and 2 minutes if you can. 2 minutes just to get every sort of surface, and look in the mirror when you're doing it. Because us as adults, when we're brushing our teeth, the phone goes, text goes, they get disturbed, and you end up brushing the same area 3 times, you haven't realised it. So actually spending the time, look in the mirror once a week, see where your brush is using, and then using a fluoride toothpaste, just to make sure your teeth are hardened and protected, reduce sensitivities, that makes the teeth healthy.
So I might have got this one wrong. I remember writing that there's too much fluoride in the diet already. But you're saying that actually most of the UK water doesn't have fluoride in it at all, so therefore actually you probably do want it in your toothpaste.
So 90% of the water in the UK has no added fluoride at all.
Right.
So the only way you're getting fluoride is if you're having toothpaste.
Right.
And the research shows that actually fluoride does help harden your teeth and reduce for having sensitivity. So as a preventive measure, fluoride is great. If you're genetically lucky enough not to have any bacteria that causes tooth decay, and you've got great diet, then you don't need fluoride toothpaste.
Tell me about flossing, because I was, so in our house we have tape, which I use because a wider one. My wife has a thinner one. Then there's some that come on a stick that then has like a loop on it, which I prefer because actually, but then you're putting the same one on several teeth. But then I also listened to a radio, I don't know, 2 or radio 4 the other day, saying, if you're a flosser, great, but don't do it intermittently. If you're going to do it every day, because intermittently is even worse. What's your whole view on, is it good? How do we do it? What should we use? Or are we barking up the wrong tree?
Fine, okay. Whole remit on flossing. Okay. So what I'm going to talk about is, first of all, we need to clean in between the teeth somehow. Toothbrush gets the front surface, the biting surface of the inside, but doesn't get in between the teeth. So we need to use something. There's a lot of sort of bad evidence out there whether we need to floss or we're not to. Why are we flossing? We're flossing really to get rid of the food and bacteria that's stuck in there. Right. And if you try and get a piece of floss, take it out and smell it afterwards, it smells disgusting. And if you really want to have the food and bacteria in your mouth, then don't floss. Otherwise, it doesn't matter what you use. What you're trying to do is physically clean the surfaces of the teeth in between. So you want something that has a snug fit. So if you've got a big gap between the teeth, floss is not going to work. You just spend 10 minutes trying to get around and get lost. So that's why there are probably 3,000 different interdental implements, and you've probably got 1,000 at your house to get in there. So what we're looking at is find something with a snug fit that fits. And unfortunately for most adults, you probably end up having 2 or 3 different sizes because there's different sizes in there. And what you're trying to do is get in between there to get rid of the food and bacteria, and ideally once a day. That's all you need to do once a day. And you'll find that if you've been on holiday and you've missed it for 3 or 4 days, and you try it for the first time, often it's a bit sore when they do it. It may bleed, and if you smell it, it doesn't smell very nice. So it's regularly doing it. Once a day is enough to do it. You can choose whether you do it more in the evening, whatever you have more time to do it. and then just get something that's a snug fit to get through, whether it's floss or whether it's tape.
Yeah.
You want something that's easy. If you've got something that takes you 5 minutes to get it all ready and then takes you 10 minutes to get around your mouth, you're not going to do it.
Yeah,
so we suggest if you get something easy, you should be able to do your whole mouth in under 30 seconds.
Oh, really?
Once a day, clean it all up, and you're going to notice a difference in your breath because all the bacteria is in there. Your breath will smell nicer and also less gum disease and less bleeding.
Yeah.
It doesn't make any difference on tooth decay. Tooth decay is all down to diet. So you can floss every day, 3 times a day, and you eat rubbish, you're still going to get decay. So flossing and cleaning between the teeth is just for gum disease and getting rid of any odours.
Is that a double-edged sword though? Because if I'm going to push it up and get it under the base of the tooth and right into the gum, am I not going to do more damage to the gum by really exercising it? Or?
No, so basically you just need to physically brush the surface or rub the surface of the tooth, and what you're going to do is nice and gently and just go down till you feel resistance, and then you take it out again. You don't want to be forcing it. If you haven't done it for a while or you've never done it before, it's going to bleed because it hasn't been done before. But after a couple of days of doing it, it won't bleed again. So that's the most important. So don't force it down there. If you're not sure, I mean, look in the mirror to try and do it, but otherwise go and see your dentist or your hygienist, and they will show you, of the 1,000 different implements you can get, they'll find the right size and shape for you and say, okay, Steve, for these back ones, we need to use this orange brush. For the front ones, we need to use tape, and they'll give you that, and then you've got a routine to carry on with it. So that would be my suggestion. Go to your dentist or your hygienist, see what works for you, and then just go for that.
That's brilliant advice. In fact, sorry, I've got one more.
Okay.
So many people, I mean, I'd like whiter teeth, but I won't go to any lengths of pain because I'm the biggest baby in the world. And I also won't go putting any peroxides in there or bleaching in there because that's obviously chemicals and totally unprimal. What advice have you got for gents and ladies that want whiter, brighter teeth without, the use of maybe chemicals?
Okay, so the first thing is brushing. So brushing your teeth properly and looking in the mirror, you can actually get rid of quite a lot of stain with that. I would use
because your teeth look really white, and I know you're not quite my age, but almost there. So I'll ask you what you did in a minute. So brushing's the first thing.
Brushing the first thing, and then using a good quality toothpaste. We recommend SLS-free toothpaste, and no sodium lauryl sulfates, no nasty chemicals, things like that.
Good.
Some of the whitening toothpaste, you've got to be really careful. They're quite abrasive. So I know you talked about charcoal toothpaste and peroxide toothpaste. Have a look at this thing called RDA value, which basically means how abrasive they are. Right, and you want to get it as low as possible. So ideally under 100, but as low as to 0 as you can do if you're using it as a regular toothpaste.
And that's kind of like, for those that are a bit older like myself, it's a bit like sandpaper. You don't want the really, really coarse grit because that's like, well, just think about how quick that gets wood off when you're doing woodwork. You want that if you're going to use it, go fine so you don't take too much off in one go.
And the enamel is the hardest thing we got in our body, and it doesn't grow back. So basically, you don't want to get rid of it. So, and if you're going to use a whitening toothpaste or charcoal, maybe you're going to use it once a week, or you're going to use it for a wedding or a special occasion. That's fine. But as a regular toothpaste, you want one that's got very low abrasivity. So that's the first thing. Second thing I would say is go and see your dental hygienist to get your teeth cleaned and polished. They use air polishers that cause no structural change to the teeth. They won't make any difference to the structure, but they will get rid of those stubborn stains. They use bicarbonate of soda and a jet wash to get rid of it. It's like taking your car to jet wash every now and then. So I would do that at least every 6 months to get them cleaned up, and that will make a big difference to it. I personally don't believe in, there's lots of things on the internet about using strawberries and lemons and mixing things up. And the reason they work is they're acid. So what you're going to do is on the layer of your teeth, you've got staining from the coffee, the red wine. You're going to use acid to get rid of it, but you're going to spit out some enamel as well, which doesn't grow back. So I would say toothbrush, maybe use some sort of charcoal or some of those toothpaste intermittently, no more than once a week, and seeing a dental hygienist to get everything polished and cleaned. And the good thing about seeing that is once they're all clean and polished, you look in the mirror, and one, you get more confident. Two, you'll actually then look after your teeth better because you think, wow, they look good. Works. This is really good. I want to actually make more of an effort in, because it's like a car. If it's dirty, you don't look after it as well.
Next question. Of my 7 children, Jessica she's 15 now. She's, out of all of them, always brushed, hasn't eaten loads of sweets, loads of crisps or anything, but she's had more fillings than all the other children probably put together. Is that genetics, or what could that be?
Yeah, it's mostly likely to be genetics, because we've found that if the diet is good and you're not having any sugary snacks and things like that, and you're going to the dentist regularly and getting things checked, if you're still having cavities, genetics. Everyone has bacteria in their mouth, that's normal, but some bacteria cause tooth decay and some cause gum disease. And if you're unlucky enough to have the bacteria that cause tooth decay, no matter what you eat and drink, you're going to likely have cavities.
Right.
So the advice for her is going regularly to the dentist so we can spot that you're genetically predisposed. So she is Jenny, so...
Jenny's a doctor, Jessica's my daughter.
So Jessica basically should be spot right at a young age, maybe at 6, to say, actually, we can see signs of early decay. Let's talk about diet. Okay, her diet is good, so therefore there's something else we need to do. So we need to seal and protect her teeth. Jessica needs to come back every 6 months to check, whereas your other 6 kids have no cavities, no problems. They don't come back every year, every 18 months. So we try as dentists to have a relationship with somebody to find out what's going on in their mouth, give them advice to say, okay, this is about nutrition, this is what you can eat that's good for your teeth, this is what you eat that's bad for your teeth. You are genetically likely to have tooth decay or gum disease, therefore you need to do more work. Some people have bacteria that don't cause any gum disease. They can brush their teeth once a week and never have any problems. Other people need to brush twice a day for 2 minutes. So we need to look at what works for most people and then genetically what is best for you. So go to see your dentist from 2 and actually see what is best for you. Do you need to be going every 6 months or do you need to be going every 2 years? What is right for you?
Got you. That's really interesting. I struggle with my entire family because nobody believes me, so it's better if it comes from a dentist.
Okay, I'll do my best. Are they watching?
Hopefully.
Okay.
But you might not even agree with me. You might say I'm completely wrong. The question is, you eat bread, which I know turns into sugar inside the body. But I was taught recently that actually the enzymes in the saliva that break down the bread break down it into sugar in the mouth, and actually too much bread can even cause tooth decay. My wife says, no, that must happen in the stomach.
No, happens in the mouth. So everyone's got, there's an enzyme called amylase, and everyone has it. And basically when you chew up bread, it breaks it down into sugar.
Right.
And what happens if, one thing your viewers can try at home is get a piece of bread, chew it up, but chew it for a minute. So don't swallow it. Normally it's like down in 5 seconds. Chew it for a minute, and after a minute you're going to notice it tastes really sweet. And the more you chew it, the sweeter and sweeter it gets. And it may get to a stage that you'll spit it out because it's so sweet. That is what's happening in your mouth.
That's fascinating.
So if you're having bread 3 times a day, you're basically dipping your teeth in sugar 3 times a day.
That's amazing. Now, I used to think I was being a good dad and give my children orange juice and apple juice in the morning. And I remember going to the dentist a few years ago before I got into Primal. And he said, do you give them apple juice or orange juice? I went, yeah, every morning. That's obviously doing the right thing. He went, well, just stop it because that's adding to the problem. So first question is it adding to the problem? Second question is, if somebody's still going to take the apple juice or the orange juice, should they do it before brushing the teeth or afterwards? Sorry, 2
good questions. No, good questions. So apple juice and orange juice, they're very acidic. So there's 2 things. You've got the sugar in it, first of all, and the acid. So as soon as you've had a glass of orange juice, what will happen is it takes about 20 minutes for your body to neutralize that acid in your mouth. Right. So for 20 minutes, you've got acid in your mouth, which slowly dissolves your teeth, will get your teeth much more sensitive. And that's why some people notice after having that sort of thing that something tastes different afterwards. So it's a matter of being careful when you have it, first of all. And the other thing is, what can you do afterwards, you said. So if you're going to still have apple juice and orange juice, if you can have it through a straw, it misses the front teeth.
Gotcha.
So that helps. And what you want to do also is try and neutralize that acid as quickly as you can. So quick swill of water for 10 seconds, that will get rid of it. Something bland or some yogurt or something that's neutral afterwards, that will get rid of it. Some chewing gum also will get rid of it as well. What you don't want to do is brush your teeth straight away afterwards. So you want to leave ideally 20 minutes after breakfast before you brush your teeth, after having anything acidic. If you're in a big rush and you've got to get out of the house quickly, quick swill of water for 10 seconds, then you can brush your teeth. But the worst thing you do is have the apple juice and then brush your teeth straight away afterwards.
And just to recap, that's because that just puts the acid right
rubbing it into it. So if you're trying to wear something away, you're putting the acid on, then you're putting pressure on it as well.
It's like putting polish on a cloth and you're
so you don't want to do that at all. But ideally, you're really not having apple juice and orange juice, especially for breakfast in the morning. But try and neutralize the acid. What we're trying to do is have neutral things in the mouth, but also they're very full of sugar.
Right. So it really comes down to diet.
Yeah.
It really comes down to what you're eating. What's your view on Weston Price's research from the 1930s, where he went around the world finding cut-off tribes where there was no dental problems? Does that kind of back up the theory here?
Unfortunately, our Western diet now it's easy and easier, more and more processed. When you go to the supermarket, probably 80% of the things that we see in the supermarket have got added sugar in some ways. And what we're finding that we're getting more and more tooth decay problems. And people don't even realize the sugar is added to some things. They think, well, I'm doing really good. I'm having a savory sandwich for lunch, but actually it's got 20 grams of sugar. Yeah. So actually looking at the ingredients is massive, and realizing when you're having sugar. Okay, I'm having a chocolate bar because I want a chocolate bar and I know it's got sugar in, and that's fine. But having something savory and then realizing that actually I'm having loads of sugar, like you say with the bread, people are not realizing. And I was, a year ago, I didn't realize that sushi, I was thinking, oh, sushi's nice, healthy lunch. But realized that the white rice is full of sugar, or converts to sugar. And then you've got the mirin that's poured all over it, the Japanese wine, again, full of sugar as well. So you think I'm having something healthy, whereas I could be having a hamburger and doing better for me. So it's actually just looking at different things, and we're realizing that we're having more and more problem. And if we actually went back generations, we'd realize that our teeth didn't have all these damage. And we're quite lucky as a dentist. I'm the first person to see the damage that can happen. So you're having sugar and you're changing your diet. Within 6 months, I'm going to see the damage in your mouth. Whereas it may take 3 or 4 years for the obesity, 5 or 6 years for having problems with diabetes and heart disease and all the rest of it. But we see the early warning signs. So getting people to come to the dentist regularly, spot things early that we can treat easily, which are going to be cheap and cost effective and not be painful because we catch it early. Whereas if you come every 3 years and we get this big long shopping list, okay, we've got to fix this, we've got to fix this, fix this. So that's the big thing.
And I guess, you want to keep your children's teeth as healthy as possible, certainly when the adult teeth come in, because that's nature's teeth, and therefore even if you're the best dentist in the world, once you start having to do fillings and crowns and work that's man-made produce that probably isn't going to be, no matter how good you are, as reliable as relying on nature to do its work.
Now, the best dentistry for us is no dentistry. We love to see people from 2 to 102 and not have to do anything with it. It's just routine maintenance, and some of our patients we only see every 2 years because we've got their diet sorted out, they're aware of something, and if there's a little problem, they notice some change, they come in straight away and say, well, this doesn't feel right, let's have a look at it. And they're aware what puts in their body. What we don't want to do is just wait till you've got a problem, and then when I fix it, whatever material I use, and the materials we use are amazing, but nothing's going to last as long as nature, and whatever I do is going to fail. It's whether it fails in a year or 5 years, but it's going to eventually fail. So then there's the maintenance, and each time you do that, it gets more and more expensive. So the best thing to do is actually look at the cause right at the beginning and say, okay, what's my diet? What's happening in my mouth at the moment? What's my dental sort of history? Okay, I've had a filling. Why is that? Don't just go to the dentist and say, I've got this hurt, fix it, and then carry on as normal, expecting that you've been doing the same thing for 20 years. You carry on, you're going to need another filling. See, I don't want to do fillings for you. I want to see you and have a great relationship and maybe cosmetically change things. I don't want to do filling holes.
It's so true, isn't it? And in fact, if we take that to its base level, that diet is totally linked to your teeth, across the UK, maybe not in your dentist practice because you're brilliant at what you do and like you say, you're trying to do prevention, not cure, but are we across the country now we're seeing more obesity, more childhood obesity, more childhood diabetes? Is dental becoming more of a problem and cavities for children than before? Or?
It's a massive problem, and the scary fact is for the number one reason children get admitted to hospital in the UK from the age of 5 to the age of 9 is from tooth decay. And that's horrific.
Hospital.
You are admitted to hospital. It's not like I've got a filling. I'm going to hospital because I've got a swollen face, I've got toothache, I can't sleep at night, I can't concentrate on work, I can't go to school, I've got an infection, I've got temperature because of my diet.
I need to hear that again. In the UK, we're eating so diet leads to tooth decay and problems. We've got the diet so wrong in our children that from 5 to 9, the number one reason they get admitted in hospital is tooth-related tooth decay.
Tooth decay, and it's 100% preventable.
Isn't that horrendous?
It is horrific. I've got 3 kids, you've got 7 kids, and it's like, what are we doing to our children?
What are we doing? In fact, this leads me on really nicely to your charity work tell me about your rewards charity and what you're trying to do, because I think that just amplifies everything we just talked about.
Yeah. So we set up a charity called the Rewards Project, and it's looking about thinking beyond sugar. So actually, how do we reward our children and how do we reward ourselves with things that are not food and sugar related? So what we're doing is going into schools. We've got a group of nutritionists, doctors, psychologists, and dentists going to schools to say, okay, what are you doing at the moment to reward your children? When you do well at a test, you give them a chocolate bar. When they have a birthday, do you allow them to all bring in cakes? What do they do at the moment? Because it's crazy what they're doing.
Yeah.
And then getting a 4-year-old to think, okay, do well in a test, I get a chocolate bar.
Yeah.
And that's setting on my neural pathways that, okay, whenever I do well, I want to feel well, I get a chocolate bar.
Yeah.
So when I get to 18, I'm at work and think, okay, I'm not feeling so good. Oh no, I'm just going to buy that chocolate bar because that makes me feel better. That's crazy. What are we doing?
Yeah. So we're setting that sort of reward and pleasure pathway in the brain too early on, that's saying I get a reward, therefore I get pleasure from sweet things like chocolate and sweets, where probably when we got the kids' party at home, and you must have had lots, and I've had hundreds, and you know, you got all those other parents trusting you to look after them for that 3 hours in the afternoon, and you send them away with a goodie bag at the end, which normally, as you say, has nothing more than sweets, Haribos, and a piece of cake. Yeah. When really, what else could we be putting in there that stopped that reward being that? Could we put in, like you said earlier on to me today, you know, could we put the balloons in there, or some stickers, or anything that says a reward doesn't have to be something that causes tooth decay, which then leads on to other things.
We've got to start young. We've got to look at, okay, how are we rewarding them for good behaviour at home and then at school? What are we doing at the moment? And it's simple. It's recognition and saying thank you and well done and certificates and stickers and stand up, Steve, and take some round of applause. It's something really easy. Doesn't need to be a lollipop or sweets.
That's brilliant. Look, it's been an absolute pleasure having you. Best of luck with the charity work.
Thank you.
And I'm going to make sure my kids watch this several times, because diet really does lead to either good teeth or bad teeth.